بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي طلاب طالبات المستوى الرابع بكالوريوس طب جراحة الفم والأسنان، أرحب بكم في مستهل اللقاء الخامس من لقاءاتنا التعليمية في مقرر طب الفم. في هذا اللقاء سنتحدث عن الجزء الثاني من Investigations. في اللقاء السابق تحدثنا عن ال first part of Investigations which is needed to confirm your final diagnosis. We had talking about the blood test. In this lecture we'll talk about the radiography or imaging. The references of this lecture, it will be the textbook of dental and maxillofacial radiology, as well as the color atlas of dental medicine and radiology, and the Burkitt's oral medicine. In this lecture, the student, at the end of this lecture, the students should be able to order the correct and indicated radiographical examination to reach and confirm the final diagnosis. And also the students should be able to mention the different types of imaging techniques regarding the conventional imaging techniques and the advanced or specialized imaging or radiographical techniques. The students also should be able at the end of this lecture to interpret the clinical findings from the radiograph and correlate them with the clinical findings to reach the final diagnosis. The student should be able to order and interpret other types of imaging techniques such as MRI if needed, or the cialography, which is the imaging technique for the salivary glands, and also the student should be able to order and interpret the CT scans, including cone beam CT scan. In this lecture we will go through the many types of radiographs regarding the techniques, indications, and the how to interpret the results of this technique.
In this lecture, we will talk about the intraoral radiographs and ultrasound scanning and extraoral radiographs and the MRI imaging, computed axial tomography and cialography, and also the cone beam computed tomography CBCT. There are main two types of radiographical investigations: conventional radiography, first type, and specialized imaging, the second type of radiographical investigation. The conventional radiography, including the intraoral periodical view. Intraoral periodical view will provide you with a radiographical view of teeth and periodical region of this tooth. This is the tooth, and also the periodical region of the tooth, and the lamina dura surrounding the tooth, the bone to which the PDL fibers are attached, and the supporting alveolar bone. This is the view which can be provided by periodical view. The advantage of periodical view, it is an excellent view of the teeth and the periodical region with minimal distortion. But the disadvantage, it cannot be used when the oral opening of your patient is reduced for extensive lesions and also for extensive lesions. So when you have an extensive large lesion, the periodical view, it is not indicated. And when your patient complaining from trismus, so he will can't open his or her mouth, so you can't put the film intraorally. The second type of conventional views is the occlusal view of the mandible, and also the occlusal view of maxillary arch. The occlusal view of the mandible will provide you with an overview of the floor of the mouth, as we see in this picture, and also the lingual aspect of the mandible, and the lower arch contour and continuity. You will see if there is any exostosis in the buccal or the lingual aspects of the lower arch. Whereas the occlusal view of the maxillary arch will provide you with a view of hard palate, if there is any lesion or impacted tooth, impacted canine as we mentioned, and the contour and the continuity of the upper arch. Extraoral radiographs. The first important one is the orthopantomograph, OPG. The temporomandibular joint, maxillary sinuses and the teeth can be appear in this view, the panoramic view. So this is the maxillary sinuses, and this is the TMJ, and this is the teeth, all teeth of your patient. Also the ramus of the mandible, the angle of the mandible, and the body of the mandible can be viewed in the panoramic view. This is the ramus, and this is the angle, and this is the body of the mandible. Posterior and the anterior border of ramus and the continuity of the inferior border of the mandible. We can see the continuity of the inferior border of the mandible by the panoramic view. Tragomaxillary fissures and also the maxillary tuberosity can be also appear in the OPG. The second extraoral view is the lateral oblique view of mandible. Lateral oblique view of the mandible, as we see in this picture, can provide us with the mandibular body projection that demonstrate the premolar, molar region and also the inferior border of the mandible at that side, and also the ramus projection can demonstrate the mandibular ramus and also the angle and the condyle of the mandible, and the third molar regions of both maxilla and mandible are also can be viewed. Posterior view or Waters view position, we can also call it occipitomental projection, which is an important view for maxillary sinuses, and the frontal ethmoid sinuses, and the frontozygomatic suture, as well as the supraorbital and infraorbital rims and the nasal cavity. Posterior view of mandible, the reverse tones projection can provide us with a view of body of mandible, whole body of the mandible, and also the inferior border, anterior border of the ramus, and the condylar neck as we see in this X-ray, and also the nasal cavity of the patient. Lateral cephalogram, it's also an important radiographical view which can be indicated or orders during the clinical dental practice, which provide us with a view of the skull and the facial bones, and also with paranasal air sinuses and the hard palate, the nasopharyngeal tissues as well. Posterior anterior view of the skull provide us with the view of the skull, the frontal and ethmoidal sinuses of the air, and also the nasal fossa and the orbits as we see in this X-ray. The lateral skull view areas provide us with the skull and the bones of the middle third of the face. Also we have the submento vertex view. Submento vertex, from its name, from the submental area to the vertex of the head. The submento vertex provide us with a view of the base of the skull as we see in this radiograph, and also the sphenoidal air sinuses, as well as the inferior border of the mandible of your patient, and the lateral wall of the maxillary sinus, and also it provides a view of medial and lateral pterygoid plates, and also the foramina of the basal aspect of the skull, as we see in this X-ray. This is a picture containing the patient placement and alignment of many types of views, and also the central beam, as well as a diagram of the patient placement. And this is the illustration, real picture of the patient position and the skull view of this views, as well as the resulted X-rays. Starting with lateral cephalometrics, the film will be parallel to mid-sagittal plane, and also the central beam perpendicular to the film. This is the illustration of the lateral cephalometrics. From here the beam will be started. This is the cone, and the position of your patient will be as this picture illustrated. The view, skull diagram, and the X-ray are presented in these two pictures. So this is the lateral cephalometric view. It is an important view for evaluating the orthodontic status of the patient and the facial profile of your patient, as well as if the patient need to undergo a surgical orthodontic procedure or not. Submento vertex view, canthal metal line parallel to the film and the beam perpendicular to the film, as we see in this picture. This is the film and this is the source of the beam. The position of the patient as mentioned in this picture, and also the graph also illustrate the position of the patient. This is the resulted view of Submento vertex. Waters view, as we mentioned before, it is an important view for maxillary sinuses. The beam also will be perpendicular to the film, and also the position of the patient as appear in these two pictures, and this is the resulted picture. So we see the orbits and the maxillary sinuses as a clear view. Posterior anterior cephalometrics also provide us with an X-ray, provided an overview of the posterior anterior position of the patient, and the reverse tone view. The beam also should be perpendicular. As we see in all views, the beam must be perpendicular on the film. This is the beam and this is the film. The beam must be perpendicular on the film. So the angle between the film and the beam is 90 degrees. One of the specialized imaging which can be ordered by the dentist is the cialography. Cialo means salivary gland, graphy means radiography. So it is a specialized imaging technique, can be used to detect if there is any abnormalities in the salivary gland or duct or orifice of the gland, so we can assess or evaluate the condition of the salivary gland components. The radio-opaque contrast media should be injected to the salivary gland from the orifice of the gland. Use of cialagogues such as lemon juice or other cialagogues to empty the gland, which gives us an empty film or emptying film. These pictures or radiographs presenting the cialographical result of the submandibular salivary gland. As we see, this is the radio-opaque material which had been injected to the salivary gland. What are the indications of cialography? The first indication to detect if there is a cialolithiasis stone of the salivary gland or any other foreign body. Evaluation of the extent of ductal damage secondary to infection. If there is an infection for the duct of the salivary gland which can cause a damage, what is the extension of this damage can be assessed by the cialograph. Evaluation of suspected location, extent and the size of neoplasm. If there is any neoplasm like mucodermoid cyst or mucodermoid tumor or adenoid cystic tumor or any other salivary gland tumor, can be assessed of by the cialograph. Also, evaluation of there is a fistula, the verticals and strictures of the ducts. If there is any strictures of the duct, can be also evaluated or assessed by cialography. Diagnosis of autoimmune disorders. The typical example of autoimmune of salivary gland is Sjogren syndrome or any other cases of salivary aplasia. Assess the patient with xerostomia or salivary swelling. So we can evaluate the cause of xerostomia. It is an salivary gland organ or other origin, and also detect if there is any ductal obstruction due to scarring or due to stool or due to other obstruction, other cause of obstruction. The CT, computed axial tomography, CT scan, is the multiple slice into image of the internal tissues such as brain, orbit, sinuses and neck. So there is a cross section of the radiographed area for inaccessible to conventional radiographs when the conventional radiographs cannot be used due to inaccessibility. Also, it is indicated for assessing if there is any pathology on the head area, the neck area, especially for determining the tumor spread. If the patient complaining from tumor, we can use the CT scan to assess the extent of tumor. Fairly high radiation exposure, and it is also expensive type of radiography. The new type of CT scan is the cone beam computed tomography, CBCT. CBCT, it is an important type of radiographs and it is commonly used and ordered during the final years. Cone-shaped X-ray beam centered as a 2-dimension detector, one rotation round the object and produces a series of 2-dimension radiographs or images, which are also then reconstructed to get a 3D radiograph as we see in this picture. Radiation dose of CBCT may be as little as 3% to 20% that of conventional CT. So it is an advantage for CBCT is its lower dose of radio or radiation. Isotropic voxels that can be as small as 0.125 millimeter. The CBCT characterized by high resolution and which helps in detecting cysts, tumors and infections, and also the developmental anomalies and traumatic injuries of the maxillofacial structures. So it is characterized by high resolution, evaluating of dental and osseous diseases in jaws and TMJs, as also the treatment planning for dental implants, which is an important indication for CBCT, showing us the bone height and the bone width as well as the bone density. MRI, also one of the types of the specialized imaging, does not involve any ionizing radiation. It is an important advantage for MRI and depends on the distribution of protons depending on the hydrogen nuclei in the tissues and their effect on the magnetic field. This is the process how the MRI work. This picture shows the machine of the MRI. The advantages of MRI: good for visualizing soft tissue and lesions, and also it is useful for imaging the TMJ, also for revealing the bone invasion. Non-radiation imaging, also we had talked about it, the advantages of MRI, and there is also disadvantages of MRI, which is number one, not good for imaging bone, so it is mainly specialized for soft tissue, not for the hard tissue. Highly risky, so the patient will enter a magnetic field. Also, it is an expensive and time-consuming radio or imaging procedure. Contraindications of MRI: implanted electric devices. When the patient has any electric devices implanted in his or her body. Intracranial vesicular clips, so it is a ferromagnetic, cannot be used for the presence of any types of metals such as orthodontic fixed appliances or removable appliances, dental endoosseous implants, the type of implants implanted inside the bone, or any metallo-containing prosthesis. So we have a magnetic field will cause ferromagnetic action for these metallic components. Ultrasound scanning, also it is a type of specialized imaging, uses the principle of echo obtained from the sound waves as they pass through the various structures. So depending on the echo resulted from the sound waves after passing the various structures, does not involve any ionizing radiation as well. Also we have the color Doppler ultrasound, useful imaging for soft tissue and internal organs as the ultrasound, and also as the MRI, mainly used for soft tissues. For example of the indications of color Doppler sound imaging or the color Doppler ultrasound imaging is evaluating the lymph node status, or also salivary gland diseases, and also if there is any foreign body inside it. In conclusion, as we said before, we had talking about intraoral radiograph, starting with intraoral periodical X-ray, as well as the occlusal radiographs, and also we had talking about the ultrasound, which mainly indicated for soft tissue diseases, Extraoral radiograph, we had talking about the cephalometrics, water's view, Submento vertex view, and river stone view. MRI, we are talking about its disadvantages, advantages, and indications. Computed axial tomography, cialography as an important radiography or imaging technique for salivary gland diseases or conditions. And finally, we had talking about the CBCT combeam computed tomography. The assignment of this lecture is the group discussion about the radiographs showed the hard tissue lesions, and also this assignment will be provided in the assignment section of this course as an attached Word document titled Assignment 5. Thank you very much, dear students, for your listening.